Hi everyone, welcome to the Collaborative Specialization in One Health information session. Before I hand it over to Katie today, I just want to remind you that this session is being recorded and the recording will be posted to the One Health YouTube channel, and a link will be made available on the One Health Institute website. The recording might also be used by the One Health Institute in the context of promoting and showcasing One Health on our campus. So if you have any questions or concerns about the recording, or One Health generally, please feel free to contact us at onehealth@uoguelph.ca. We also will have the Q&A function enabled throughout the presentation, so if you do have questions, please feel free to put them in the Q&A chat. And just before we get started, and to give everyone some familiarity with using that function, if you wouldn't mind telling us what department or level, whether undergraduate or graduate, you are joining us from today, that would be great. So we'll just give you a few minutes to put that into the chat box, and then I'll pass it over to Katie.
All right. Thank you, Alex. Hopefully everyone can hear me okay. It's always a bit odd speaking to a screen, knowing that other people are there, but not being able to see you. So as Alex mentioned, today will be just a brief information session on the Collaborative Specialization in One Health. This is a pretty new program at the University of Guelph. It was launched in the winter of 2020. And this will be sort of our second cohort of students that will be starting this fall. And so, as Alex mentioned, my name's Katie. I'm an assistant professor in the Department of Population Medicine, and I'm also the graduate program coordinator for the Collaborative Specialization in One Health. So today, just to give you a brief outline, I'm going to give you an overview of the program and then spend some time talking about the admission process, because that is what's coming up in the future. And then, as Alex said, we'll have time for a Q&A. So any questions that you do have, please place them in the chat box and I can work on answering those. So probably an important question before we even get into the program is, what is a collaborative specialization? And so collaborative specialization, there are numerous ones that exist on campus. There's one in international development, and others in neuroscience, and I'm probably going to get all of them wrong, but the different collaborative specializations can be found in the graduate calendar. And what they are is essentially an add-on to your primary program of study. So you need to be registered in a primary program, so a department and a master's or PhD program. And what it's designed to do is supplement and enhance your disciplinary training. So essentially, you're applying tools and skills and knowledge from your primary discipline, but you also need to bring in other tools, skills, and knowledges to be able to enhance your thesis research. And so it really builds skills and knowledge in an additional area of specialization, and it's suitable for students that are actually using that specialized skill set and knowledge from different areas in their thesis. And so they're not designed for students that might just have an interest in that area, but aren't applying them in their thesis. And so, for example, in undergrad, you can take a minor in sort of an area that you're particularly interested in. For a collaborative specialization, there's the requirement that you're actually applying the skills and knowledge in your thesis research for it to be a suitable fit as a program for you. And so if we apply this now to the Collaborative Specialization in One Health, so it is an add-on program for students registered in a participating program. And so participating programs, there's a good number of them. These are programs that have some sort of research that is related to One Health. And they believe that providing this opportunity for their students is a good fit because that research program exists. And the list of participating programs can be found in the graduate calendar under the Collaborative Specialization in One Health. And then the other thing is, as I was saying, that you're applying One Health in your thesis so that you are actually using what's being taught about One Health in your research. And so there are a few key components that you need to complete successfully in order to complete the collaborative specialization in One Health. And just as a primary program, this is something that appears on your transcript and on your degree to say that you did this additional training. And so the first two components are the two core courses in the collaborative specialization in One Health. So One Health 6000 is the One Health Approaches to Research course. This runs in the winter, and this is the foundational course for the collaborative specialization. Really, it goes over, from the basics of One Health into lots of different tools and skills that are utilized in One Health, and helps you develop the ability to apply that skill set in your thesis research. Then One Health 6100 or 6200, so there's two course codes depending on if you're in a master's or a doctoral program, the One Health seminar. And that occurs in the fall, with the One Health Approaches to Research being a prerequisite to this course. And that's really an opportunity to see research, One Health related research that's occurring across campus, and see how One Health is being applied. And really engage with other researchers and your peers and develop more of that collaboration and sharing of knowledges. And then finally, thesis research utilizing a One Health approach. And so a big question we get is, how do we foster the utilization of One Health approach in thesis research? And there are a few key ways that are sort of built-in checkpoints in the program to make sure that One Health is being utilized in your thesis research. So the letter of intent, which I'm going to talk about shortly, and that's part of the admission process, is sort of our first screening tool. And that's designed to set students up for success. So we want students in the program that will be applying One Health in their thesis, and not those that are just interested in it but don't have the ability to apply it, because this is a research-based program. And then you need to successfully complete a research proposal as the final project in the One Health Approaches to Research course, where you outline your thesis research and how you are or intend to apply a One Health approach. And the second component is that there must be advisory committee support. And so one member of your committee must be a core faculty member in One Health. And that full listing of core faculty members is listed again in the graduate calendar under the collaborative specialization in One Health. And most of these faculty are those that have expressed interest in being involved in this program and that they utilize One Health in their research program. And so maybe you're already working with one of them as your advisor, or there are sort of synergies in different areas of research, and you can approach one of them, of course, with the assistance of your advisor, to be part of your committee. So to be admitted into this program, we sort of have two different routes, all of which end up in the same sort of end result. It just sort of depends on if the paperwork is done in advance or the paperwork is done later. It's really what it comes down to. So you can apply to the collaborative specialization in One Health through your university application through OUAC. And some of you that may be on the line have already done this, as we have a few students that have registered for the program. When you do this, you're granted preliminary acceptance, and we ask that you sign a declaration of commitment form that outlines the different components of the program and sort of what will be expected of you. And then after that point, you are required to submit a letter of intent, which is due November 1st, and then you need to have a satisfactory evaluation to continue on in the program. And as I said, the purpose of that letter of intent is to really set students up for success. For current students, so maybe you've just started in the fall, maybe you're a year into your program, particularly if you're a PhD student, you can still apply into this program. So the caveat for current students is that you need to have enough time left in your program to complete the requirements. So essentially, if you're a year into a master's thesis, it's going to be pretty difficult to do that, because the courses will take the winter and then the following fall. And so it sort of depends when you've started and what your current plans of study are. For a PhD student that might be a year through, there's a little bit more wiggle room for time, and so that might be feasible. And of course, if you've just started, there's lots of time to be able to complete the requirements. And so for this cohort of students, the letter of intent is due November 1st, same thing. And again, you just need a satisfactory evaluation to be able to enroll in the program. And so, as I said, the route that you go, it really just depends on when the paperwork is done. So if you're a current student and are admitted, then we need to do a program transfer form so that we can add on the collaborative specialization. Doesn't mean that you're leaving your current program, it just means that you're adding another one on. So there's a little bit more paperwork to do on that end versus if you're a prospective student and applied in, then we had the declaration of commitment form that needed to be filled out. So the letter of intent, the instructions and the rubric are accessible at the One Health website. So the easiest way to get there, I put the link there, but just onehealth.uoguelph.ca. And there's a tab on programs, and you can find the page for the collaborative specialization in One Health. The purpose of the letter of intent is designed to assess potential that you're going to apply One Health in your thesis. So essentially, we recognize that students that are writing this letter of intent have probably just started. And so by November, you might have about 2 months of working on your thesis and planning your research. And so our expectations are not unreasonable. I like to reassure you that we're not expecting you to, be able to talk in detail about every aspect of your thesis and exactly how it's going to go, because we're all researchers and we know how thesis research evolves. So that's why we say potential is that you need to have an understanding of what research you're going to be doing and be able to draw connections to show that you can apply One Health. We really highly recommend that you consult with your advisor during this time because it's important to, you're working with your advisor to plan out your thesis. It's important that they know of your interest to apply into this program. And it's important that, any ideas that you might share or things that you'd like to incorporate with your thesis, that your advisor is able to comment and know if this is possible and if it's a good fit for your research. And so having those ongoing consultations with your advisor is highly recommended. So this isn't something that you have to develop in isolation. Really, we would prefer that your advisor is involved in the process. So it's due November 1st, submitted to my email, so kclow@uoguelph.ca. And once they're all submitted, they're assessed by a committee with faculty representation from all colleges. So, I'm in the Department of Population Medicine, I'm a veterinarian and an epidemiologist by training. So I have one perspective versus, we have faculty members that are from the College of Arts or our social scientists, and they provide a different perspective. And so just as in the true sort of nature of One Health, it's highly collaborative the way we review these proposals, and it allows us to sort of see the scope of One Health research. So I'd like that to be reassuring that if anyone's applying from some of the social sciences and humanities, that there are lots of perspectives looking at these. And so we'll have a good holistic view of the type of research that you're doing. So this is just a cut and paste excerpt from the letter of intent instructions. And so there's a few components that we would like you to address in your letter of intent. We want you to describe your interest in One Health and why you want to complete this collaborative specialization, just briefly. Provide an overview of your proposed thesis research. And then the really important part is to clearly illustrate the potential alignment of your research with a One Health approach. And the key things that I want to emphasize here is you should be looking at sort of all the components of a One Health approach, and we provide the university definition at the bottom of this page. And also we encourage you to think of your thesis broadly. And so there's certainly not the expectation that you're collecting comprehensive data in animal population, human population, and a certain environment. That can be very challenging to do, and we realize that there are restrictions on the feasibility of certain research. However, there is the opportunity in other areas of your thesis to examine the interconnectedness between those three components. And so this might be in your literature review, in how you analyze and interpret your data, and then how you talk about the relevance of your research. And so all of those are valid considerations. And so we want you to think about your thesis broadly and how you might apply One Health. Also posted on the website is the review criteria, so our standardized rubric that all students, that all letter of intents will be compared to. And it's divided between the 3 areas that we ask you to address. So I do ask that you look at those instructions and address each component. And it's divided into unsatisfactory, satisfactory, and outstanding. So an overall satisfactory and an overall outstanding, both are justifications for admission into the program. The differentiation between the two columns is that if we have an overwhelming number of applications, there are limits to our enrollment, and so that just allows us to sort of differentiate candidates based on their letters of intent. If you have an overall letter that's deemed unsatisfactory, you won't be allowed to, if you're a student that's applied and been in the program, you won't be allowed to continue in the program. Just the collaborative specialization, not your primary program. Or if you're applying in, you won't be admitted to the program. And really this isn't to, this is really, I just want to stress that the purpose of this is to set you up for success, because we want you to be utilizing a One Health approach throughout your thesis. And if your thesis really isn't a great fit for the program, then, you know, we don't want to admit you and then it be a challenge all the way along, particularly, you know, in the courses and applying your research if it's not going to be possible. So that's the real purpose of this letter of intent. So just a recap on some important dates. So November 1st is when the letter of intent is due. So, you know, by the end of the day, 11:59 on November 1st, if you need an exact time. And then within the letters of intent are reviewed quite quickly, and applicants are notified by December 1st. And then at that point, you can register for the One Health Approaches to Research, because that course is, restricted to students in the collaborative specialization, at least first. It's given first priority to those students. And then in the following fall, you will take the One Health seminar. I think those are all of the pertinent points that I'd like to provide you with this program. I'd also like to highlight that there is the website, the One Health Collaborative Specialization website on the page on the One Health website. And so that's a great area to look for any information. And like I said, the instructions and rubric are posted there. Either a link or this video will be embedded. So if you have questions, you can come back. And then also look at the graduate calendar. And so the graduate calendar is sort of the official documentation for the university, and where, you know, all of the program's procedures and policies are documented. And so you can find a lot of really helpful information in there. And essentially you just have to go to the graduate calendar, you know, Google it on the University of Guelph website if you're not familiar with it. And then click on collaborative specializations, and under collaborative specializations, you'll find One Health. And it's only, you know, 3 or 4 pages, so it's not too onerous of a read, but it is really helpful for you to understand sort of the scope of the program. Okay, so as I said, it probably wasn't going to take me too long to get through those slides, but we can open it up to questions now. And I think Alex is going to help me moderate some of those questions.
Yep. So thank you, Katie. We have one question asking, is this program appropriate for someone completing a major research paper as opposed to a thesis?
Yes. So if your program, if you're in one of the participating programs, and you are mostly course-based, It's not eligible for students that are fully course-based, but if you have a major research project and in that project you can apply a One Health approach, you are eligible for admission.
So that's the only question in the chat box. If anyone has any further questions, please feel free to write it in there, and we'll give that a few minutes. I've also put the website that Katie was referring to for the collaborative specialization in One Health. I put the link there in the chat too, so that's where you can find some of those application materials. Well, it doesn't look like we're getting any other questions. Katie, maybe you can let everyone know how they can reach out if there are questions after today.
Yeah, certainly. So I'm sort of your first point of contact for the collaborative specialization in One Health. So certainly if you do have questions, particularly after you've read some of the supporting material, it's always helpful if students read some of the material first, because sometimes that gives you the easy answer. But certainly if you have questions, you can reach out to me. So my email, as I said, is kclow@uoguelph.ca.
Oh, looks like we have another question. Has anyone ever done the One Health collaboration while completing an MSc in planning?
So the MSc in planning, is that in rural planning? Or I'm not familiar with what department that's based in. So if you could put that into the chat box.
If the person who asked the question about the MSc in planning might be able to clarify in the chat whether they're referring to rural planning. Yep, so there you go, in the School of Environmental Design and Rural Development.
Yes, so I believe I'm just going to stop sharing this screen and pull up a different screen just to show you. I don't want to give you the wrong answer. Just might take me 2 seconds to find it. There we go. Okay. Okay, so hopefully you can see my screen. I've just pulled up our program brochure. And so here you can see a list of all the participating programs. So rural planning and development is on the list. And the asterisk means it's only for thesis-based masters or those for a major research project. And that's put there because some MA and MSc programs in our university are only course-based. And of course, because this collaborative specialization is designed for the application and research, that's why there's that caveat. We do believe, I believe we have one student that is currently registered from that department. And the other thing that I would like to emphasize is just because a student hasn't completed the collaborative specialization in that department really doesn't mean anything at this point because we've had nobody complete the collaborative specialization because it's so new. So yes, students from environmental design and rural development are completely eligible, and we do have one. But to comment on, you know, a student's experience in that program, because the program is so new, we just don't have a lot of that that perspective yet. So hopefully that answers your question.
Thanks, Katie. And we just had a question about whether this presentation was being recorded. So just to reiterate that it is being recorded and it will be made available on our website if you know anyone who wanted the information but was unable to attend. It seems like that might be it for questions. So maybe it would be a good time to wrap things up. Oh,
yeah.
Oh, sorry, I spoke too soon. We have one other question. If One Health, would One Health allow students to audit the coursework required?
So the two required courses are, they're restricted entry with priority given to students in the collaborative specialization. That being said, if they're, so the courses are capped at 25. The cap is really meant so that the classes can be highly interactive and really discussion based and really focus on that skill development and building collaboration in the classroom. So last year we had a small cohort of students, and so we had 5 that were in the collaborative specialization and 5 that were just taking the course, and we also had an auditor. And so it would be something that you would have to approach the instructor. So I teach the One Health Approaches to Research, and then Dr. Jane Parmley teaches the One Health seminar. And so certainly you would just have to express your interest. And then once we sort of know the capacity in the course and that we have room for all the students that are in the collaborative specialization, there would be an opportunity to join those courses. But for the collaborative specialization to actually, you know, complete the program and have it on your degree, you do have to do the courses for credit.
Thanks, Katie. Not seeing any more questions in the chat, but I know I keep saying that. All right, so if there aren't any more questions, I think we could probably wrap it up there for today. Like Katie mentioned, she's a great point of contact if you do have further questions after you have a chance to review some of the supporting materials that she mentioned throughout the presentation. And I know that that brochure that she has pulled up on her screen does have her contact information at the bottom as well. And you'll be able to also find that on our website that I've linked in the chat. So thank you so much, everyone, for joining us. We really appreciate you attending. And like I mentioned, the recording will be made available on our website.
Thanks, everyone.